Canine rehabilitation is a new field in veterinary medicine, and with any new field, you need people that are certified in the techniques. And so what I decided to do is to assemble a team. The first piece of the puzzle was getting Dr. Ryder to get some advanced training. Dr. Ryder's already done 20 years of advanced orthopedic surgery, but with rehab, we wanted to get extra training, which he did several years ago. So he's the director of our rehabilitation center. The second puzzle piece was getting Meredith White certified. Meredith is a veterinary assistant, did extra training, and now she's our certified canine rehabilitation assistant. Our next step was adding Kevin McCarthy. Dr. McCarthy is a human chiropractor who got certified in veterinary chiropractic techniques, and then he joined our team, which gives us another modality and another way of doing canine rehabilitation therapy. Our last puzzle piece, which really completes our rehabilitation center, was the addition of physical therapist Ann Rizzoliti. Ann is a human physical therapist. She just recently got certified as a canine rehabilitation therapist. So I love that we take modalities from human medicine with Ann, her techniques, and bring those to veterinary medicine to help our patients.
I think that in an ideal world, every pet that has surgery or an injury would go through a rehabilitation process, because with the various modalities that we can have success bringing them closer back to normal than we can with just rest, time, and medications, which is our standard treatment. The process of pet rehabilitation is very similar to what they use, the model in human medicine, where you have surgery or an injury. The first place you go is the physical therapist. We can do the same here with the Pet Rehabilitation Center.
When humans have knee replacements, they have to do extensive physical therapy. So when we're doing a TPLO surgery or another kind of cruciate repair on an animal, it's only natural that therapy is going to benefit them enormously.
When we look at canine rehabilitation techniques, we can go from the very basic to the very advanced. Basic techniques are things like balance techniques, range of motion where we're moving the joint, all the way through to underwater treadmill therapy and using the effects of gravity, getting rid of gravity so the animal floats and is able to walk, maybe for the first time in some patients.
Underwater treadmill we use a lot, therapeutic cold laser, therapeutic E-stem, we use TENS and MES, we use therapeutic ultrasound. Targeted exercise is a big part of what we do here and what we send home with clients. You know, the animals are typically apprehensive. Of course, they're in a strange place with this strange person doing weird things. And but what's funny is these animals start to come in regularly for rehab. Owners tell me that they actually perk up when they are told, come on, we're going to go to Metzger's for rehab. The dogs, you know, they get comfortable with the process. A lot of them, they'll walk right into the underwater treadmill once they've gotten used to it and really not flinch at all. So we kind of, we become friends over the 4 to 6 weeks that we're working together.
The team effort at Metzger Animal Hospital for rehab is really key to the success that we have and the results that we get with the animals that we're working with. I do the chiropractic aspect of it, and Dr. Bob is the one usually that's either doing the surgery or clearing the case for rehab. And so we're always collaborating and talking to each other. There's always an ongoing conversation of what are we going to do next and trying to stay one step ahead of everything. I practice applied kinesiology when I do chiropractic. It's a very gentle form of chiropractic, and what I do is I do a lot of muscle balancing first, and then I adjust the bones afterwards. And what that allows us to do is hold the adjustment a lot longer.
Once we have a proper diagnosis, we can make a proper plan utilizing our team, whether that's with surgery, whether that's with rehab, whether it's chiropractic or medication, or even the regenerative therapies like stem cells. Then we can find what's best for the animal to treat the specific injury or disease process that's going on. Without that diagnosis, though, we're shooting in the dark, and it doesn't work as well.
Rehab for animals is just as important as it is for humans, if not more so, because the animals can't tell you where it hurts, and they have no means to convey the pain they're in.
It was really hard to see Bruno when he had injuries to his legs just because he wasn't himself. He didn't want to play, he didn't want to go on walks, which is just not like him. I mean, he's a young lab and it was just hard to see him like that. But when we did the surgeries and we went through the recovery and went through the physical therapy, it brought him back again, and he's a young dog again, and he plays with my other dog. He is definitely the same loving dog that he was before.
If we're offering the state-of-the-art surgeries and the best surgical care, we need to be offering the state-of-the-art rehabilitation services in order to get the animals as close back to normal as we can.
Anytime that we can decrease the amount of medications and do something more holistic is going to benefit the patient and also their long-term health.